So I think right now, the research sphere really lends itself to using this pre-screening tactic because we're not hinging the diagnosis on the biomarker. Ultimately, these patients are going on to get their PET scans or perhaps their CSF biomarkers. So we're learning more about these biomarkers from trials that actually aren't even intended to study the biomarker itself. So we're kind of reaping some secondary benefits in that regard. However, if we look, and really I focused more on what these biomarkers can teach us in terms of prognosis. But the other thing that I think a lot of us are especially interested in, and our patients are interested in, is what can they teach us in terms of diagnosis? And that's very different. So it'd be great to have a biomarker that can tell you if you have a disease and how quickly it's going to progress, or is it going to progress? Those are two separate things. And so we are amassing a large body of evidence on how these plasma biomarkers can function in the clinical context, both for diagnosing someone with symptomatic disease. So you say you have someone come into your clinic and they've got some memory issues, you can order this test and then say, yes, looks like it's Alzheimer's disease, or no, it's not. We're getting closer to that. On the other side, though, and perhaps this may have more broad consequences or ramifications, is what can it tell us about asymptomatic people? Because we're talking about all of these disease-modifying therapies, and we want to get earlier and earlier and earlier in the disease process. And we know, we've known for a long time, that the amyloid, the tau, these are changes that are taking place in the brain decades before we see the emergence of any symptoms. So if we could initiate a treatment that early, then we could really do what we're trying to do, and that's prevent these symptoms from ever happening. And so is a biomarker good enough to be able to diagnose people then, and then we prevent all the symptoms from happening? So that would mean that we need a test that we use like many of our, routine health screens in the clinic. So, should a blood-based biomarker be ordered in addition to someone's cholesterol panel and their hemoglobin A1C and their vitamin B12 when they're coming in for their annual exam? And when that biomarker ticks off positive, should that be the trigger that we start one of these therapies? I think that's where we're hoping to go. We're not there yet, but we're definitely making strides in the right direction.